Thank you. As always, joined by Dr. Syed Hussain from Trinity Health of New England to try to fit in as much as we can. Doctor, a pleasure to see you.
Likewise.
Again.
Good morning.
Good morning. Okay, first things first. You might start hearing more in the coming days and weeks, maybe, about a pharmaceutical company named Vertex that has presented new data on an experimental drug. Got to stress that. It's experimental, but they say it might be able to reduce acute pain and become an alternative to very addictive opioids. What do we know about it? And is this just, I think I was saying before, should we just be saying, okay, let's just slow our roll in case anybody gets excited over this?
So this is promising, Tim, because anything we can do to bend the curve of the current opioid epidemic that we have raging across the country is welcome news. So it's a welcome step. More data is needed on how effective it is. This experimental drug is supposed to act outside the central nervous system where opioids usually act. So hopefully there's no addictive potential here. It's for moderate to severe pain, especially after surgeries. Right. And so it remains to be seen how effective it is and what side effects it may carry. But like I said, it's welcome news because keep in mind, viewers should remember that based on CDC data, there are 220 deaths from opioid overdoses every single day in the country, which is enormous.
Yeah.
So, you know, any interventions that can dent this is welcome.
Yes, that's something. We'll keep an eye on it. All right, something else we need to keep our eye on. The Centers for Disease Control and Prevention said there's been a sharp increase in syphilis cases in women nationwide. They said it's now an epidemic. It's raising concerns. We should mention numbers are going up in men too, but more so in women. What's going on there? Yeah,
this is a brewing public health crisis, Tim. This is very, very concerning. In some population groups, if you look at the data, like Native Americans, we've regressed to where we were pre-penicillin for syphilis rates.
Pre-penicillin?
It's that high.
I thought you were going to say pre-pandemic. No,
pre-penicillin era. That's how far we've regressed.
Yeah.
And women have seen a 17% jump year over year in syphilis cases. We've seen an increase in newborn syphilis cases, along with the inequities that have persisted are still there and have gotten worse. So what basically we need to do is make screening more widely available, increase public awareness of this condition, what the symptoms are, what to look for, educate our clinicians, and then make sure that treatment modalities are available outside the regular normal healthcare setting. We need to target these impacted populations to bring this under control. We've done it in the past. We can.
Yeah, no reason why we can't do it again. Let's talk about children's anxiety. What can parents do to help manage that? I know sometimes that's tricky. It's like also in the same realm as building self-esteem. It's not something you can just give your child. They have to help on their own, but how can you help them to help themselves?
Yeah, this is a pretty large, detailed, topic, but what I'll say is viewers should keep in mind that it's a holistic approach to mental health that a child needs. It's not just medication, it's not just one or two interventions. It's comprehensive. What plan are we putting in place? So have that open communication line with your healthcare provider. Have a trusting environment for the kid. Make sure there's adequate support. Behavioral therapy is helpful. So making sure that the child feels supported. So it's a marathon, not a sprint. Right. So it's important that we think long-term when it comes to mental health for children.
And medication, especially with mental health issues, a lot of parents are very worried about that. Is there an age that's maybe at least too young to consider medication for a child?
So it depends on what therapies have been, non-medical therapies, non-medicine therapies have been tried and whether they work or not work. But if a child continues to exhibit symptoms of anxiety, that's when, if the child's healthcare provider is prescribing them, that's probably time to consider that strongly.
There you go. Okay, Sam, thank you so much. We always try to get 3 topics in, get to them quickly, get as much as we can. You're an expert at it.
Thank you.
Doctor, thank you. Good to see you.